Hello everybody, this is James and I greet you. Today we will discuss the management of nephrotic syndrome, which requires a comprehensive approach that involves accurate diagnosis, treatment of underlying causes, and management of symptoms. The goal is to reduce proteinuria, prevent complications, and preserve renal function. But before we start, let's have an overlook of the guideline medical mnemonic that can help you organize your checklist when managing nephrotic syndrome. So bring in the guys who can tell if you were dehydrated just by looking at your photos. The nephrologist, consult and refer your patients to them for expert review and good recommendations. Embolic events. Prophylactic doses of anticoagulants are used to avoid embolic events. However, there hasn't been much evidence regarding the practice of this recommendation. Electrolyte monitoring. The use of diuretic therapy may subject to complications such as electrolyte derangement, especially in the hypovolemic state. Therefore, you must use them with caution and monitor the electrolytes. So reduce the proteins in the urine, and this is the main target of therapy. This can be achieved through angiotensin converting enzyme inhibitors or angiotensin receptor blockers. They are able to reduce the intraglomerular pressure, dilate the efferent arteriole, and lead to decrease in proteinuria as well as a reduction in the systemic blood pressure. It's been shown that there is expression of angiotensin receptor 1 in the podocytes, and so these agents can also sort of regulate the podocyte as well. They are considered nephroprotectors. Hyperlipidemia. Among the lipid-lowering agents, statins are commonly used in reducing the lipids that accumulate in nephrotic syndrome, which can in fact lead to cardiovascular events, and especially with the concurrent hypercoagulability state that we see in nephrotic syndrome. So we do recall that in nephrotic syndrome, there is lipoprotein synthesis increase, and together with the hypercoagulability state, this poses a big risk for cardiovascular events. The mechanism of statins is through the reduction of HMG-CoA reductase that helps reduce the synthesis of cholesterol. Statins are also able to reduce the peripheral blood levels of LDL by mobilizing them into the liver due to the activated LDL receptors in the liver as the liver reduces the cholesterol synthesis. Some of the side effects may include muscle damage, rhabdomyolysis, as well as liver damage. Other lipid-lowering agents that may be used includes bile acid sequestrants. Example is cholestyramine that binds to bile acids in the intestines and decrease the enterohepatic circulation of these acids. The result is that the liver will try to use the cholesterol storage to produce more bile acids, which reduces the lipid levels to some extent. Fibrates reduces the availability of fatty acids for the synthesis of very low density lipoproteins through the regulation of a peroxisome proliferator activated receptor alpha. They cause a substantial decrease in the triglycerides. However, the reduction of the LDL is quite moderate. Other agents such as niacin or the PCSK9 inhibitors, which is a monoclonal antibody, targets the LDLs in the peripheral blood and degrades them. Lipoprotein apheresis in focal segmental glomerulosclerosis and idiopathic nephrotic syndrome have shown better results. Renal replacement therapy dialysis may be indicated for an end-stage kidney disease as a result of nephrotic syndrome that presents with a uremic syndrome, a GFR of less than 10 or even less, metabolic acidosis, patients being unresponsive to diuretics, or any severe derangement of electrolytes may actually be indication for a renal replacement therapy. Now, regarding restrictions, patients may be restricted of taking excessive salts, so 2 grams per day will be okay. Now, regarding fluid, patients are not allowed to stop drinking at all, but limited to about 1 liter per day is also okay, and calories should be maintained around 1 gram per kilogram per day. Managing edema is essential in nephrotic syndrome. Loop diuretics and spironolactone are needed, especially in the absence of renal failure and severe hypovolemia. You would like to weigh your patient on a daily basis and target about a 0.5 to 1 kilogram loss per day. Severe hypoalbuminemia may complicate the achievement of adequate diuresis. For example, any albumin levels that are less than 15 grams per liter may actually make it very difficult to achieve an adequate diuresis. In such cases, albumin infusions may also be indicated. In general, you'll like to use diuretics very cautiously while you monitor the vitals and electrolytes, as patients with nephrotic syndrome may already have a hypovolemia. Congenital nephrotic syndrome and end-stage kidney disease may require renal transplantation. Immunosuppressive agents play a key role in the management of nephrotic syndrome. Agents such as cyclophosphamide, mycophenolate mofetil, calcineurin inhibitors are used when there is the need to induce remission or when there is frequent relapses, even though treatment may also depend on the type of histologic pattern of the nephrotic syndrome. Infection control and immunization. Prophylactic antibiotics are recommended, such as penicillin for patients. Prompt paracentesis and treatment of peritonitis. Immunization, example against varicella, influenza, pneumococcus, but not during the relapse phase or when immunosuppressive agents are given. Corticosteroids are very useful when there is the need to induce remission in many forms of nephrotic syndrome. They are the mainstay of therapy in idiopathic nephrotic syndrome. Minimal change disease also has a good response from corticosteroids. Patients that are taking corticosteroids for long term must be assessed for steroid toxicity. Evaluate for the cause. Now, aside the primary cause that can be minimal change, that can be membranous or proliferative, you must also evaluate for secondary causes such as diabetes mellitus, amyloidosis, hepatitis, systemic lupus erythematosus, and cryoprecipitants may all be causes of nephrotic syndrome. Thank you, and I hope this was useful. If you enjoyed it, then hit the like button and subscribe to the channel. Bye.